Thank you, Mr. Chairman. I appreciate you hosting this hearing today. And I know that I want to start out by healthcare inflation is a problem for everybody in the American economy. It's the number one driver of inflation in the 21st century. What we have now doesn't work. And so hopefully we can constructively have conversations about how we make it work. And one of the ways that we have driven down some costs are over-the-counter drugs, moving prescription drugs to over-the-counter drugs. It saves American consumers $170 billion annually. Working with Senator Hassan, we have a streamlining marketplace access and reform for therapeutics called Smart OTC Act, which will help the FDA identify drugs that could be candidates for over-the-counter and help companies move those to over-the-counter more quickly through the FDA. So I would encourage us all to look at that as we move forward. Now, Mr. Cuban, thank you for the example that you used with the monopoly and Amazon. That's in consumer products, which we know is troublesome. Higher, monopolies create higher prices, lower quality in general. But that's in a consumer marketplace. Healthcare, oh my gosh, people don't have choices at all. They have no choice for most people about where they go consume that healthcare, and I think that you make a great point. But the healthcare system seems to be conspiring to create a monopoly, marketplace monopolies, across all aspects of what it does for a service that everybody must have, which makes the pressure of cost and quality even more stark. And so I do have, Mr. Molds, I want to ask you a question about anti-competitive contracting for healthcare. Because we know it creates a monopoly environment, it increases costs. I'm going to give you 4 examples, and I want you to react to these. All or nothing clauses, anti-steering, anti-tiering clauses, most favored nation clauses, gag clauses, which create anti-transparency. All of those carve up marketplaces, don't allow for competition. I want your thoughts on what eliminating them might do to improve patient benefits, quality, and lower costs.
So we've actually been involved in litigation on some of these at CalPERS in California. The all or nothing clauses in particular were the subject of a lawsuit there, and in general, they are some of the challenges, but by no means the only challenges. We are seeing in California increasing consolidation, not just in the north. I mentioned that our costs are about 35% higher in the north, but in the south, where we've historically seen pretty good, comparatively good.
You have consolidation, though, and in contracts that restrict, isn't that,
so some of
the combination, isn't that lethal?
Potentially, absolutely, yes. So some of these provisions we don't see as commonly in contracts in California anymore, but we still have consolidation.
Yeah. Mr. Cuban, you understand markets pretty well. You have a reaction to those?
Yeah, I think it's awful. As an example, we wanted to build on CalPERS, and it was fair. They told us that we didn't carry certain brands, but we just asked, why not add cost-plus drugs to your network? Because if we're cheaper, buy from us, and if we're not, don't buy from us. Cost-plus drugs doesn't have exclusives with anybody. We just stand by the fact that we think we'll be better for patients because we're less expensive. And so we were told, and this isn't just CalPERS, any of the big PBMs, when I go and speak to a CEO, I give them the test. And the test is just ask your PBM if you can add cost-plus drugs to your network, and only use us if we're less expensive. 100% of the times, they've been told no.
Yeah, Mr. Mold, do you have something you want to add to that?
I want to just start by saying that Mr. Cuban's work in this space has actually been enormously helpful to us. Having his prices out there have helped us negotiate prices in our contract, so we are grateful for that. We did negotiate in our most recent contract that starts in January a provision that allows us to carve out So we continue to look at where we can
So
get
is that a
the
yes?
cheapest drug. That is a always open to the conversation,
Okay.
not a yes.
Well, and I'll just close with this, is that you talked about consolidation. You have these tools that are used inside the marketplaces where people want to consolidate. They want to limit others competing in their space, which allows them to basically command whatever price they want. No market would work would work well like that. But in a healthcare marketplace where people don't have choices, I can decide if I'm buying water, I may decide to buy something else. But in healthcare, I don't have a choice. And I know that's what Mr. Smith's trying to do, create choices. But I'm hopeful that we can eliminate some of these tools that are being used to carve up markets and drive up prices. Thank you, Mr. Chairman.